Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on contact dermatitis under the section of dermatology. So, what is contact dermatitis? It's a type of eczema caused by contact with exogenous substance. It's divided into two groups. One is allergic contact dermatitis, and the second type is irritant contact dermatitis. As for its epidemiology, it's really quite common. In fact, it is responsible for 30% of all reported occupational diseases. In terms of its pathogenesis, for allergic contact dermatitis, it's an antigen-driven due to activation of memory T cells. So it's a type 4 or delayed allergic reaction on further exposures. The common culprits to cause this disease are nickel, fragrance, and rubber. As for the pathogenesis of irritant contact dermatitis, it's due to a cumulative exposure. The culprits are commonly known as detergents. However, it could happen after a single exposure in a reaction to a very strong substance, such as wet cement. In terms of its signs and symptoms, for allergic contact dermatitis, it's really quite similar to those of eczema. If you like a revision of signs and symptoms in relation to eczema, please click here on our previous video. As for its acute cases, can cause blistering disease. If they happen later in life or if they have an atypical distribution compared to those of classical eczema, then you need to be thinking about contact dermatitis. As for the signs and symptoms for irritant contact dermatitis, it mostly affects hands of patients whose occupation involves repeated hand washing and use of soaps or detergents, such as healthcare workers or domestic cleaners. As for its investigation, the history is key. Patch testing can be done to confirm or exclude allergic contact dermatitis. Remember, it's an antibody-driven response. And you can also check for serum immunoglobulin E. The treatment of it is really to identify and avoid the triggers. Then, once that's done, for symptomatic management, you can consider using topical emollients and steroids. If that's not healing the disease or not responding, you could consider systemic steroid. And then finally, and very rarely, and only under dermatologist advice, you can consider using phototherapy or azathioprine in severe cases. As for its disease association, it's important to note that all atopic patients have higher risk of developing irritant contact dermatitis. The prognosis of it is usually really quite good if you can identify and avoid the irritant. And patients with history of atopy normally have worse prognosis. So let's do some questions now. Question 1. A 60-year-old lady who works as a domestic cleaner in the hospital presents with a 4-month history of gradually worsening erythematous rash with associated blisters over her hands. There are no other systemic features. Given the likely diagnosis, what would be the most appropriate plan of action? The options are 1. PUVA, 2. Oral steroids, 3. Oral azathioprine, 4. Identify and avoid trigger, 5. Oral tacrolimus. And as you guys recall, this is quite clearly describing a case of irritant contact dermatitis. And if you remember from our talk earlier, the correct option is option 4, which is to identify and avoid the trigger. Thanks for listening to this episode of Bite-Sized MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.